Good afternoon. My name is Emma Dinkelspiel. I'm a staff attorney at Bay Area Legal Aid, and I'm here with Sarah Hart, who will be kicking us off.
Perfect. Thanks, Emma. As Emma said, my name's Sarah. I'm also a staff attorney here. There's a lot of content. If you have questions, you can ask it in the chat or we'll pause, throughout. And then Emma and I are gonna keep our eyes on the chat as well, while the other's presenting to hopefully answer your questions. Um, and we will jump right into it because, like I said, there's a lot of content, a lot of changes this year. So we'll discuss some of those, but if you have more specific questions, let us know. All right, so just a brief overview of who we are. We are the Health Consumer Center, so we work out of Bay Area Legal Aid. We're a legal advice hotline, and we provide free assistance on healthcare coverage and access issues, which can look like a lot of different things. So that's, legal advice, brief service, or extended representation. Most of what we do is legal advice, where we explain to people, here's what the policies, rules, procedures are, and how you can kind of navigate that and some advice about those processes. We have free language interpretation services for any language that folks are calling in with, and we serve 8 Bay Area counties. And unlike some of our other teams at Bay Legal, all our services are open to all income levels. And so, as I said, this could look like a lot of different things, whether that's health plan eligibility or enrollment issues, the actual access to care. So, plan denials, et cetera, for various reasons. And that runs across all types of insurance. So, Medi-Cal covered California, Medicare, private health insurance, and that does include employer-based insurance. We also answer lots of questions about medical debt and then assorted other, county health um, areas. And so the best way to get in touch with us is through our hotline. That's right now we are open Monday through Thursday, 9 a.m. to 1 p.m. So you can or clients can call us directly at that number during that time. Like I said, we have service available in all languages and it's free. There's no income requirement. And if you have clients in other states or you end up speaking with, or not other states, sorry, other counties, there's other organizations throughout the state that serve other counties, but we are the main touch point for Bay Area uh, counties. And so first, just kind of a really high level Medicare and Medi-Cal. This, is my full-time job, and I still sometimes mess those two words up, but they are very distinct things. So Medicare is the program for folks that are 65 or older or blind and disabled, covers hospital services, physician services, and prescription drugs. Medi-Cal is for low-income individuals, and there's a little bit of a broader array of benefits available. So it's the, hospital services, physician services, as well as long-term services and supports, dental services, and some other things that are sometimes not covered under Medicare plans. And so Medi-Cal, what actually is Medi-Cal? Medi-Cal is the federal and state funded health insurance program for low-income people in California. And so it's administered at the statewide level by the Department of Healthcare Services, DHCS, um, but it's actually provided and eligibility is determined at the county level, so through the different county social services offices. With one caveat, there's always a caveat. This for folks that have SSI, their Medi-Cal eligibility is determined by the Social Security Administration. That's called SSI linked Medi-Cal. And when we talk to folks and we're asking about their Medi-Cal eligibility, we often ask them for this benefits identification card. The one on the right is the one that most people have. It's a bit newer. And so that is how we can, at least on our team, confirm someone's Medi-Cal eligibility. And so Medicare is a
Okay.
much more federal program. And so it's administered, through CMS, and it's for individuals who are 65 or older, blind or disabled. And it's usually tied to people's Social Security or SSDI benefits. Though there are some exceptions there. And there's three main parts to Medicare. That's when you hear all the acronyms come into play. So Medicare Part A is hospital services. Medicare Part A is generally free if you've worked 40 credits, or have had 2 years of SSDI or ESRD. If you're not eligible for premium free Part A, then there is a way to still obtain Medicare Part A if you're otherwise eligible by paying a premium. Part B is outpatient services. So everyone pays a premium for Medicare Part B. The caveat star there being unless you're also enrolled in Medi-Cal. So we'll spend a lot of time talking about what that looks like. The premium for 2025 was 185, and this 202.90 is the 2026 Medicare Part B premium. And then Part D, is Medicare prescription drugs. So when you hear someone say they have original Medicare, that means that they have Part A. That usually means they have Part A, B, and D, though those are separate parts. Now, when you hear people say Part C, that's the Medicare Advantage plan. So those bundle Part A, B, and D benefits into one plan called a Part C plan. They have their own premiums. Those are the ones that are run, like through Kaiser, Blue Shield, etc. And so, as I mentioned, it's very common for people to have both Medicare and Medi-Cal. In situations like this, they're, a Medi-Medi beneficiary, and Medi-Cal is always going to be the payer of last resort. So when people have both, Medicare is going to be the primary payer, and then Medi-Cal is billed after Medicare has paid their share. And so for Part B physician services, the standard, payment rate, Medicare pays 80%, and then the leftover 20% is billed to Medi-Cal. And so that means that if you're Medi-Medi, you should not be billed for any services. So you should not be billed for copays or deductibles. Even if Medi-Cal actually doesn't end up paying on it, you still should not be billed for that. Um, with the exception here of Medi-Cal does not pay for Medicare prescription drugs, but there are some limits to how much you can be charged for that based on certain programs. And yeah, I see a question here. Sadika, do you have a question?
My apologies. No questions on my end.
Ah,
Sorry.
no problem. Okay, so there's a few different types of Medi-Cal coverage. So we're going to get into kind of the weeds of Medi-Cal stuff here. Um, and so there's free full scope Medi-Cal is what most people receive, and what, most common that we see, and that when people are generally talking about Medi-Cal, it's when there's that $0 out of pocket, no cost sharing, you're not paying anything for those services. For adults, Medi-Cal pays for medically necessary health care. And for kids, there's actually a broader coverage standard. So it means the standard is to correct or ameliorate, which means that there's generally more services that can be covered for kids up to the age of 21. Medi-Cal with a share of costs is something that we see. It's something that people call into our team a lot about. But I think is less common in the general population. But when someone has income that's too high for free Medi-Cal and is in a certain type of Medi-Cal coverage, which we'll talk about. And so that's when there's a certain amount that they have to pay out of pocket before Medi-Cal actually will start paying on those. That also applies to folks that are in long-term care, have long-term care Medi-Cal, so are in basically a skilled nursing facility. And then emergency Medi-Cal for adults without satisfactory immigration status. So the Medi-Cal eligibility criteria. So there's income limits. There's two different types of income limits for Magi or non-Magi. We'll talk more about that in a second. Starting in January, so starting in January 1st, 2026, there are asset limits which have been reinstated. They were not in existence for the last 2 years, but they're starting again January 1st for non-Magi eligibility categories. And then residency requirements. So folks have to live in California with the intent to reside. Um, and then coming soon will be Medi-Cal work requirements. We won't get into that so much right now. We don't have a ton of detail about how that's going to be implemented yet, but more to come in the future. So who gets Medi-Cal? So like I said, with the SSI piece, there are a few categories of people where if you're enrolled in a certain benefit program, your Medi-Cal is linked to that program. So that's SSI, CalWORKs, et cetera. Seniors are people with disabilities, um, low income adults ages 19 to 64, and then lots of other specific, um, benefit and age group categories of people who could be eligible for Medi-Cal. For example, pregnant women and former foster youth up to age 26. And so when you're determining Magi versus non-Magi, so the non-Magi Medi-Cal or age-blind disabled, oftentimes that corresponds with the receipt of Medicare. Medically needy, people in long-term care, skilled nursing facility, or folks that are enrolled in the 250% working disabled program. And then as a reminder, that's the group where the asset limits are being reinstated. And then for Magi, that is the income counting rules that apply for the expansion group, ages 19 to 64, pregnant people, kids up to 19, and parent caretaker relatives. So Magi stands for Modified Adjusted Gross Income. And so these are the two different income counting ways that someone could become eligible for Medi-Cal, which I think will make more sense on the next slide. It's always a little hard to determine which order to put these slides up in because they all kind of inform each other. But if we have more questions on that, we can certainly come back to this one. So what is Magi? So that it's generally related to taxes. So it's the adjusted gross income and non-taxable Social Security benefits. And so oftentimes it's just people's gross income, and that's kind of the end of it. There are some deductions that are taken, but for example, if someone's receiving Social Security benefits, that is their Magi income calculation. There are some common tax deductions like the student loan interest deductions, but the most important thing here is that expenses do not affect that. So you can't deduct expenses from your Magi income calculation. At least the most common expenses, rent, utilities, things like that. There are some income exceptions where that's not counted for Magi Medi-Cal. Most common that we see are state disability insurance, and then if you are an IHSS provider for someone who lives in your home, the income that you receive for that is not counted towards your income calculation for Magi Medi-Cal. So what actually are those income limits? So this is for 2025 and for a household of one. And so we'll talk in a minute about how a lot of this depends on household size. But for a household of one, the 138%, so that's, for Magi or for most non-Magi groups, is $1,801 per month or $21,597 per year. And then for kids, there's a more generous income standard. More rare to see a kid in a household of one, but this is the kid household of one standard. The monthly income would be 3,472. So it's also common where, a kid and a parent in the same household will have different types of eligibility because of that uh, age differential there. So eligibility is determined based on whether the applicant falls with a certain income based on that household size, like I was saying. And so generally the household size is the household tax, like who's considered in the household is the household tax filer, the spouse, and then any dependents they claim. And then as I was saying before, there's a few different income exceptions there with self-employment income and then IHSS income where IHSS providers, if they live in the same house, that income is excluded from gross income. And so then once you have the household whose income is, looked at, and so eligibility is determined on an individual basis, but you count all of those in that Magi Medi-Cal household. And so sometimes family members of the same family have different household compositions because you do it based on, the person who's applying for eligibility and then their tax relationships with each other. And so this may result in, a child's or tax dependent income counting for someone in a household, but not someone else. So you really have to look at each person individually when you're making these types of calculations. And then another really common thing we see is fluctuating income, whether from self-employment or seasonality or things like that. If income fluctuates, people can use either their current monthly income or their projected annual income. And so projected annual income is helpful if, during some months the income would be higher, but then there's some months without any income. So on average over the year, if someone's below that annual threshold, it would be, beneficial to use that annual income. And you can request to use that instead. And so then there's the non-Magi groups, and they have both income and asset limit requirements. So the Magi groups, it's just based on income and intent to reside. And then for non-Magi, there's the income plus the asset limit. And so the folks in these categories are age, blind, and disabled medically needy programs, 250% working disabled programs, folks that have a share of cost and are in skilled nursing facilities. And for when you're making the income determination for people in this category, there are different deductions that can be taken, and those deductions vary from program to program. So often, medical premiums can be deducted from the income. So any Medicare premiums that someone would owe, or anything else that they're paying out of pocket, and other types of, earned income deductions and stuff like that. So I think I got ahead of myself there, but this is talking more about the countable income for that non-Magi Medi-Cal. And so the medical insurance premiums, like I said. So one thing to note on that is you can deduct that Medicare Part B premium, even if Medi-Cal is paying that Part B premium. So if you, are receiving both Medicare and Medi-Cal, you can take that Medicare deduction. There's an automatic $20 deduction that just applies across the board. And then there's different employment income deductions. So there's some kind of complicated calculations that you can get into where you're deducting, a standard $65 deduction and then other work-related expenses. And then you divide that in half. So those calculations become really important when you're trying to find someone's share of costs. And so the share of cost is based on the countable income, not the gross income. So what we just talked about, all those deductions, et cetera, that's how you find someone's countable income. Then when you're trying to see if someone has a share of cost, that's if their countable income is above the Medi-Cal threshold. So if their income is above that, 1801 per month for a household of one, but they're still eligible for Medi-Cal because they're in that, age blind disabled category or another category, they could still be eligible for Medi-Cal with a share of cost. And so to find that share of cost, you find that countable income and you subtract the maintenance need level. The maintenance need level is very low. It's only $600 for a single person. It has not changed in, 40 years. So people's share of cost end up being pretty high. Um, so here's an example. So if you have that, countable income is, $2,000. Which is above the threshold for full scope Medi-Cal. And then you are subtracting that $600 maintenance need level, you end up with a share of cost of $1,400. So that means that someone has to spend $1,400 on, medical care before Medi-Cal will kick in to cover that. And so that can be a really high burden, especially if someone is applying for IHSS or some of those types of programs. And so they already have Medicare, they have Medi-Cal with the share of cost, but the Medi-Cal is not paying for much um, because there's this really high share of cost. And so there are ways to eliminate that share of cost. And so there's a few common strategies that we use and that people can use. So one is the supplemental medical insurance. So this is most effective when someone is right above the countable income threshold. So it's 1801 if their income is like, 1900 or $2,000 or something like that. Because of that deduction for medical premiums, if someone buys additional supplemental insurance, for example, a vision or dental plan, that can be deducted from that countable income, which then brings them below that 1801 amount. So if someone is, at $1,900 with their countable income, they buy a vision plan that's $100, that brings them to $1,800. It's below that full scope threshold, and then that fully eliminates the share of cost. Another program that can be used for many folks is the 250% working disabled program. So this is for people that are eligible for this program are people who have a disability and have disability income because that disability income is basically disregarded if they're doing some other type of work. There's a lot more nuance and technicality there, but it's a really great program for people that have a really high share of cost and have a disability, and either a lot of their disability income is making them ineligible for full scope Medi-Cal. And the other thing that can be really useful is spousal impoverishment. And so that is a program where someone's income is calculated a little bit differently. If it's a married couple where one member of the couple is severely disabled and requires, like care to be able to stay in their home, like a nursing facility level of care, but is provided at home or in a nursing facility. And so what the spousal impoverishment program allows is it splits the household into two individual units. So you can split the income between the couple, and each member of that couple carries their own income. And then it's much more common than to be under that threshold for a household of one than when their combined income is under for a household of two. This makes a little bit more sense when you're actually looking at numbers. Happy to answer questions on that one as well. So here's some of these numbers. So, oh, sorry, so those other things we talked about were how to fully eliminate a share of cost. This section is talking about how to manage if you actually do have a really high share of cost and how to kind of navigate that system. And so, you can spend down that share of cost. So you can, combine all your unpaid bills, health services, etc., into as few months as possible, because those can be used to offset and reduce that share of cost. Um, and so, for example, if a family has a $2,000 share of cost, there's an outstanding medical bill for a really high dollar amount, then that can be, allocated across many months, and count towards that share of cost. Once that share of cost is met, then Medi-Cal is going to cover the rest of the services for that month.
Okay, so we've got some examples about how to do the math here. I think this is where we were switching over, right, Sarah? I'm not misremembering.
Yep, yep.
Yeah,
Sorry, I
yeah. So
sped through that, but
no, it's beautiful. And if we're able to give you guys some time back today, maybe we can take that time to go in depth on some of these programs that we've described briefly. So let's start with an example. Feel free to answer this one in the chat, as you read this, and I'm going to talk through it. So John and Jane are married and they live together. John and Jane are both 65 years old. John receives 1,200 in Social Security income. Jane gets 1,200 in Social Security income as well. They pay 400 combined in Part B and C premiums. So are they eligible for free full scope Medi-Cal? I'm using the 2024 number on this slide for the just so we can practice the math. So let's say that they're calling you in 2024 for this purpose. Are they eligible for Medi-Cal at that time? What do folks think? I'll give people a moment to answer in chat. I'm seeing a couple of yeses. I'm seeing a no. The ayes have it. John and Jane are indeed eligible. In 2024. They are and they so let's talk through how we calculate it. So their joint income, gross income is 2,400. That's where we start out. We say, what is the actual total dollar amount of the money that's coming in? 2,400. None of this is employment income. We don't deduct any of the employment deduction. So we just treat it all as unearned income. We take off that $20 automatic deduction that gets subtracted from all non-Magi income calculations. Then we subtract out the $400 in medical insurance premiums. That's the other permissible deduction. And we see they've got 1,980 in countable income, which is under the maximum income for a couple that year. Now we've got a slightly different scenario. Jane has employment income of 2,000 and unearned income of 1,000. So I'll tell you up front with this one, Jane is over the income limit for Medi-Cal. Jane does not qualify for free full scope Medi-Cal at the moment. Assuming she doesn't qualify for any specialty programs, what is her shared monthly cost? For your reference, for 2025, the income cutoff is 1,801, but we're looking at shared monthly cost here, so it's a different calculation. Ellen asks, is it the $20 automatic deduction per household or per person? That is actually a good question. I believe it is per household. I can double check. So Jane's shared monthly costs, let's talk through this. So shared monthly cost, the 138% federal poverty level cutoff is actually a red herring for shared monthly cost. We look at gross income only. We still go through the countable earned income calculation, right? We still look at that. So we subtract her income in half. We take out the earned income deduction. I'm sorry, there's a typo on the slide. 90 instead of 65. We subtract the automatic income disregard of 20, and then we divide the whole thing by 2, which is 957.50. Then we add the whole unearned income of 1,000, That's 1957.50, and then you subtract out the maintenance need level, so that's 600. So her shared monthly cost is 1957.50 minus 600. There's a couple of typos on the slide that I will correct, but we're looking at 1957.50 minus 600, and that comes to about 1,400 a month. So we've got John. His only source of income is Social Security disability income in the amount of 1,700 a month, and he is in a nursing home. What is his monthly resident cost? Does anyone remember how we calculate share of cost for a nursing home? So for a nursing home, the share of cost calculations are much harsher. And the residual allowance permitted is very, very minimal. It's $35. That's right. I see Ellen and Justin have gotten that right. So 1,700 minus 35 is 1,665. That is how much John is paying basically as nursing home rent to his skilled nursing facility, unless he qualifies for an exemption or a protection. So I hope it's helpful. Thank you, Sarah. Sarah has confirmed that the rule is $20 per household for the
I
automatic deduction.
I had to look that one up too. I did not know it off the top of my head.
There are worksheets that the counties make available for this, and that DHCS makes available for this, that can be very helpful in terms of just getting the basics of these, because there's no way around it. These are very finicky calculations. We don't carry all this information in our head all the time because there's simply too much of it. But it's good to go through some of these questions for practice to get a sense of how the math works out and sort of how you can get a sense of whether someone's going to qualify or not. So now we've talked through assets. I'm sorry, now we've talked through income. Let's get talking about assets. Uh, this is only for non-Magi Medi-Cal members who are not categorically linked to another program. So if you are getting your Medi-Cal because you're on SSI or because you're on CalWORKs, you already are subject to an asset limit that is much lower. For SSI, it's 2,000 a month for an individual. If your income is below 2,000 a month, your assets, what's in the bank is below 2,000 a month, then it's definitely below the Medi-Cal limit, which is far, far higher. Magi Medi-Cal participants also have no asset limits by law. This is a federal protection. So doesn't matter if you have $1 million in the bank, as long as there's no income coming to you from that is countable on your taxes. You can still qualify for Medi-Cal based on just income if you are in the Magi population group. But for everyone over the age of 65 and everyone getting Medi-Cal based on a disability, the asset limit is coming back. So the individual asset limit is 130,000, and the asset limit for a couple is 195,000. There are many exclusions to what is counted as an asset. If you have done SSI practice or if you are an SSI recipient, you're going to be familiar with these exclusions. They're very similar. Your primary residence is not counted. You can own your own home. That's not a problem. You can have a car, and if you're a couple, you can have two cars. You can have property used for business. Let's say that you have a third car as a couple, and you use that to drive to your plumbing job, and you need that for that purpose. That can in some cases be an exempt asset. Even in some cases, rental properties can be an exempt asset because it's a property that's being used for business. Assets are binary. By that I mean, with income, we have this sliding system where you can qualify for free if your income is below a certain cutoff, and then you can qualify with a share of cost if you're over a certain cutoff. Assets do not work that way. If you have $131,000 in the bank, you are ineligible for Medi-Cal starting January 1st, 2026. On top of that, there are also transfer penalties. If you transfer your assets such that to make yourself eligible for Medi-Cal, that's not a problem for normal day-to-day receipt of Medi-Cal. Medi-Cal is fine with you doing that to go to the doctor, to get your medication, to receive IHSS. or other home and community-based services, to go to the dentist, that's okay. But as soon as you need nursing home care, Medi-Cal will then, as soon as you get on long-term care nursing Medi-Cal for the first time, Medi-Cal will then look back a certain amount of time and say, did you, in the last number of months, uh, seek to transfer money so that you would be eligible for Medi-Cal? And if you did, that transfer can disqualify you for long-term care Medi-Cal for a certain amount of time. The way that they do that math is they will say, um, did you transfer more than the cost of 1 month of long-term care? So basically, if you transfer 14, let's say that you have $144,000 in the bank, and you say, I want to get on Medi-Cal, and you transfer 14,000 to your son. You give your son $14,000. Wonderful news for your son. And you then apply for Medi-Cal, you receive Medi-Cal, there's no issue. 6 months later, you enter a nursing home. At that point, Medi-Cal looks back and says, okay, you gave away $14,000 as a gift. That means that you have 1 month of disqualification for long-term care, um, because you gave away roughly the cost of one nursing home stay if you were paying out of pocket. This number is going to go up in 2026. It's calculated based on the average cost of a nursing home out of pocket, so it goes up every year. But this, at the moment, it's about 13,000 a month. The fact that it is about 13,000 a month makes it clear how important it is to avoid these transfer penalties. It is also possible, we won't get into this in depth. I really would recommend consulting an organization called California Advocates for Nursing Home Reform, or CANR, for detailed information about this particular landscape, because they're the experts. But there are certain ways that you can say, you shouldn't apply this penalty to me. This would be a hardship. I can't afford nursing home care otherwise, or things like that. But it's good to try to avoid that altogether if possible. Now, you might be saying to yourself, wait a second, Emma, I took this training last year and you said there are no asset limits in Medi-Cal. Or you might be saying, wait a second, Emma, I took this training 5 years ago and you said that the asset limit was $2,000. This has all changed quite a bit over the last few years. Asset limits were originally set to $2,000. They followed SSI and at the time also CalWORKs. They were then increased under California law up to $130,000, and then eliminated for 2024 and 2025. And now they're coming back due to the California budget crunch. That means that asset limits are not currently in place. So when will they matter for your client? Before January 2026, there are no penalties for any transfers of assets. So you have, or your clients have, about 2 weeks to move money around completely freely. There will be no consequences whatsoever. This will not be counted as part of the look back period. It will not affect your eligibility for long-term care. After January 1st, 2026, assets will bar eligibility at renewal. What that means is the next time your client has to renew for Medi-Cal, let's say that that's in June of 2026, the Medi-Cal will then and only then ask, okay, what's in your bank account? What assets do you have? Do you have a second home? Do you have 3 cars? And see if those assets exceed the limit. That is the rule for the upcoming year. That's how Medi-Cal is handling it. That means that there are a lot of people who are going to need to worry about their assets for the next few months. It's going to be a recurring issue. You might be saying, look, I primarily work with an unhoused population. I'm not working with any clients who fall into this category. You would be surprised. We actually do see a lot of clients who have Social Security assets coming to them, back pay, or who have parents who have left them a trust, or something like that, or who have set up a trust based on the asset forgiveness period, the asset waiver period, and now have to worry about unwinding it. One thing to keep in mind is that the CalAble accounts are and have always been exempt. So if you have a client who's eligible for a CalAble account, it might be a good way to try to protect some of those assets. I'm seeing some stuff in the chat that I see that Sarah has been answering, which is fantastic. Thank you. one question here is how can they check if clients have assets overseas? Uh, Lying to Medi-Cal is fraud. So they can't in all cases. They may not be able to detect whether or not clients have assets overseas. Of course, if the client is receiving income overseas or they get information received about assets overseas, then they have to act on that. But it's possible that Medi-Cal will not be able to detect a second home, you know, back home. Uh, I wouldn't. I would really not recommend going that route. Medi-Cal fraud is pursued very aggressively. Medi-Cal is normally a very forgiving program. You can't lose Medi-Cal retroactively. You you know eligibility is extended for the maximum period possible. That goes out the window when a county believes that somebody might be committing Medi-Cal fraud. Okay. We're going to get into a little bit more detail on the Working Disabled program. So Sarah gave a wonderful overview of this before. I'm going to talk a little bit more about some of the specific criteria. Medi-Cal, so you must be disabled. You must have either a Social Security or a Medi-Cal state level determination of disability. You must have minimal employment. That means you can work for $1 an hour, 1 hour a month, but you must get some amount of money for your labor. This can be babysitting, it can be gardening, it can be picking up cans, it can be folding pamphlets in church. It can be anything that qualifies as actual work for which you are actually getting paid, but it need not be work over a certain limit. There's no requirement that it be substantial gainful activity or that it look like a real part-time job or that you pay taxes on it. It just has to be real. Non-exempt income must be below the SSI limit. So what that means is that your unearned income must come in below the so let's say that you have $1,000 in SSDI and 1,500 in a pension. That 1,500 in a pension is unearned income that is not based on a disability and it gets counted. It's not under the SSI limit. That person is not eligible for the Working Disabled program. But if the numbers are switched around, somebody has $1,000 from a pension and 1,500 from SSDI, then the pension is the non-disability, non-employment income. It's exempt and it's non-exempt and it's below the line. So it's important to remember that finicky detail. Not everybody who has a disability and has disability-based income is going to qualify for the Working Disabled program. So we've got an example here. Mary receives $1,000 a month in SSDI benefits. She works 8 days a month. She gets $600 gross. And she pays a neighbor $10 a day to drive her to work. She can't get on a bus because of her panic attacks. So is she eligible? Yes, Mary is eligible. She gets her SSDI income is exempt. We do not even look at the SSDI income. We forget about it for the rest of these calculations. It's not counted. Her employment income is $600 a month. And she pays a neighbor $10 per day to drive her to work. So we subtract $20 from the countable earned income. We subtract, in this case, it is actually $90 from the countable earned income. And then we take out the impairment related work expense and divide that all by 2. That comes to $217.50. She's eligible because that amount, her countable income, is way below the limit. She definitely qualifies for the Working Disabled program and she can enjoy all the benefits of that. We wanted to talk a little bit today about a program called CalAIM. That was another part of the major expansion, which of the last few years, which is the California Advancing and Innovating Medi-Cal. I think quite a number of you may work for CalAIM agencies or agencies that participate with or receive benefits from CalAIM. These are one of the ways that California delivers a lot of its care to unhoused people and really low income people outside of just straightforward medical care. Case management, housing supports, things of that nature. CalAIM comes in two main categories. One is enhanced care management, and one is community supports. These are really important benefits, and they are only available through Medi-Cal managed care plans. So you're in Santa Clara County, that'll be Santa Clara Family Health Plan, or Kaiser Permanente. In Alameda, might be Alameda Alliance. In a lot of the North Bay counties, it might be Partnership. That plan is responsible for offering these programs, and you would go to the plan to receive it and qualify. Enhanced care management. This is case management that is meant to meet people where they are. It's meant to use a whole person approach to address clinical and non-clinical needs of high need beneficiaries. In terms of meeting people where they are, that's meant to be literal. The ECM case managers are meant to, the regs specify that they are meant to literally be able to physically meet clients where they actually live. And you are meant to have a care manager to coordinate care and services, including a whole suite of possibilities. In reality, we're seeing some issues in terms of ECM provision. We're seeing a lot of folks getting referred to traditional care management agencies that maybe aren't set up to provide this full scope of services. It's important to remember that ECM is enhanced care management for a reason. It really is meant to be coordination of care across the spectrum of a client's needs. So who's eligible for ECM? Who are the populations of focus? Unhoused people, high utilizers of emergency room with nursing care, people experiencing first instance of psychosis, people transitioning to the community from incarceration or nursing facilities, CCS members, people who get California Children's Services benefits, welfare involved children and youth, former foster youth, and adults with serious mental illness and substance use disorder are some of the major players. We've got an example here from the rollout document for ECM. So Frank, our ECM participant, has struggled with opioid addiction. He's been living in San Francisco for 4 years. He's been to the ER 7 times because of, in the last 2 years, because of overdoses, and he keeps going back to the street. He got COVID, and he's experiencing long COVID now. What can ECM do for Frank? ECM can connect him with a care manager who can then help take him to a food bank to make plans to see a mental health provider. They can help follow up with his primary care doctor to make sure that he actually gets his appointments. They can connect him to a community supports provider to help him get housing. We're looking at a holistic approach to his care, and it really is the provision of making those phone calls, making sure that the care is actually provided. It really is meant to be medical case management first and foremost. So I mentioned community supports providers. These are services that have been provided through various different funds over the years and are currently being channeled through managed care plans primarily now. These are a cost-effective alternative or substitute to traditional medical services or settings. And they are still available despite all the cuts, despite everything. They are still going forward. They are available for your clients in 2026. They have not gone away. There are 14 pre-approved community supports available to different Medi-Cal beneficiaries, and different plans have selected different ones. I believe in Santa Clara County, we're looking at all of them, and here they are. Notice that a lot of these are housing focused. Medi-Cal can provide quite a lot of housing assistance to vulnerable and low income and unhoused individuals. They just need to qualify to be part of one of those populations of focus. If somebody needs rental support, security deposit support, modification so that they can live safely in their home, these are services that your Medi-Cal MCP managed care plan might be able to provide. There are also personal care and homemaking services that's over top in-home supportive services to provide additional personal care, usually on a short-term basis, to somebody who needs a little bit of extra help around the home. Then there's recuperative care or medical respite. This is a big one. Patients who have been discharged from an ER and need to be able to stay somewhere safe. Maybe there's not a shelter bed available. Medi-Cal can pay for a respite care stay for that for that person in a maybe a more independent setting by managed by a respite care provider. Um, and then finally, there's a medically supportive meal benefit that might provide assistance in getting access to food tailored to somebody's unique disabilities. Um, I'm going to skip over this additional example. Um, ECM and community support, as I said, are provided through your managed care plans. They are often administered through a third-party agency. It can be difficult to get these benefits for your client. Be persistent. If your managed care plan says, "Oh, I don't know what this is," um, that's that's probably not the final answer. And these are entitlement benefits. Members who are eligible for it are entitled to receive that. That means that you can file an appeal, challenge the failure to provide those benefits, just like you would any other kind of medical benefit. I see in the chat somebody saying ECM benefits have a high wait list. Have you noticed this? I certainly have. It is absolutely true that we are seeing barriers to accessing these badly needed services. Um, I would recommend that if you are seeing that consistently in a county that you serve, that you consider reaching out to DHCS and letting them know they are interested in how these services are being provided. And I have found that the Department of Healthcare Services can be helpful in accessing these benefits when we're struggling to coordinate with a plan. So that's one possible option for resolution. I also see in the chat a question about whether or not VA disability payments are useful for a working disabled are exempt for the working disabled program. Yes, they are. Any disability-based benefit or disability income is exempt under that program. What that means exactly is sometimes ambiguous, but it isn't in the case. A service connected disability payment is going to be a disability payment. If they don't have a disability payment, if they have some kind of service pension that is not related to disability, that may not be exempt. The working disabled program is often a great solution for veterans because their service connected pensions can be so high. Uh, we want to talk about some other benefits that are provided to um, outside of a managed care plan. Medi-Cal provides dental benefits via a program called Medi-Cal Dental. That used to be called Denti-Cal. I think they're trying to brand it as Smile California at the moment. Medi-Cal Dental is the formal name. Medi-Cal Dental provides dental coverage to Medi-Cal members, and on the one hand, it is a misconception that Medi-Cal members cannot get dental care. On the other hand, the amount of dental care that Medi-Cal members can get is somewhat limited and can be difficult to find an eligible provider. If you can't find a provider, what the state wants you to do is to call the telephone service center and request a referral through that. You can also apply for complex case management if you have a particularly complex set of dental needs and you think that the normal run-of-the-mill dentists that you might be seeing are giving you weird conflicting answers. By far the highest number of balance billing and billing abnormality cases that we see are dental related because of the irregularities of what are and are not covered by Medi-Cal and other programs, and the low payment amounts that are associated with Medi-Cal dental, meaning that dentists are very commonly will say, yes, we accept Medi-Cal, but we're not going to try to bill Medi-Cal for this, whatever service it may be, because we know they're going to say no, and we don't want to put the trouble to it. When in reality, if you were able to appeal it all the way through, it may be that Medi-Cal Dental would approve it. This is just an ongoing issue that we're facing, and it's important to keep an eye out for dentists who are able to reliably take Medi-Cal and able to serve Medi-Cal populations without balance billing them. Medi-Cal RX is the prescription benefit for Medi-Cal. prescription medication is no longer covered by the managed care plan unless you're on PACE, which is a specialty program for folks who have both Medicare and Medi-Cal and are a senior, and all your care goes through them. If you or these other two specialty programs, which are less common. There are there is a special drug hotline for prescription drugs. It's on the screen, and you will get all this after our second half of our presentation tomorrow. And you can get responses, complaints are resolved within 72 hours for prescription drugs just because it's such a speedy and difficult issue. So we really, really recommend that if you're running into trouble with your medication, call the Medi-Cal RX drug hotline and see what help you can get there. And then finally, we wanted to, finally today, we wanted to touch on how you apply for Medi-Cal. There are no wrong doors for Medi-Cal. You are meant to be able to apply any way that is best for you. You can do it on coveredcalifornia.com. Especially if you are in the Magi population, that's probably the most efficient way to do it. That will screen you and determine, are you eligible for Medi-Cal or Covered California with premium tax credits with subsidies to help you pay for your care. We're going to talk a lot more about Covered California tomorrow. So if you're saying, wait, I don't know anything about Covered California, stay tuned. If you're pretty sure you're not eligible for that, or you have a complex situation, or you fall into one of these other eligibility groups, you might want to apply, or you want to get food stamps as well, CalFresh, General Assistance, or General Relief, CalWorks, you can apply through the county website, which is benefitscal.com. It's the same website for every county. Benefitscal.com allows you to submit the county level Medi-Cal single streamlined application for all benefits. That application will ask you a lot of questions, only some of which are relevant to Medi-Cal because they're also screening you for CalFresh, CalWorks, and often General Assistance as well. If those options don't work well for you, you can apply in person, by mail, or over the phone. While you are waiting for your application to be processed, you might be eligible for what's called accelerated enrollment. This is conditional but full scope eligibility for people who are waiting for their application to be processed. For Magi Medi-Cal applicants specifically, it doesn't matter how you apply, but you do need to be Magi Medi-Cal eligible. You can start using your Medi-Cal right away while your Medi-Cal is pending, and you can keep it until they determine a final answer. So what that means is, let's say that you apply and you say, hey, I think my income next year is going to be 20,000. I live on my own. I have a part-time job. I think my income is going to be $20,000. That makes you look automatically eligible for Medi-Cal. That application will be sent to the county. The county will process it. And in the meantime, they'll send you some information so you can start getting care while the application is going on. If it turns out that your income is indeed around that area, they'll say, great, you're eligible for Medi-Cal. Come on in. They'll mail you a Medi-Cal benefits identification card, and you can start enrolling in the program. If it turns out conversely that you are not eligible for Medi-Cal, if your income is maybe 22,000, it's over the cutoff, you will be discontinued from Medi-Cal once that determination is made, but there will be no retroactive termination. You don't lose your benefits going back. You don't have to pay anything back. Just make sure you represent your income in good faith while this is going on. We've ended up with some extra time. Let me take a look in the chat.
Yeah, I was going to say there's a question if you can specifically request accelerated enrollment.
That's a great question. So you shouldn't have to request accelerated enrollment. It should be automatic. In reality, I would say that sometimes counties don't always spot that. So if you apply on Covered California, you will be given it is fully automatic. They send you a notification saying you've been found eligible for Medi-Cal. You can use your Medi-Cal while this is going on. Here's how you do that. Here's your information in the meantime. And you can take that to, for example, a local urgent care that takes your Medi-Cal, or to, CVS to fill your prescriptions, that kind of thing. Anywhere that takes fee-for-service Medi-Cal, hospital, anything like that. If you apply through the county, you might need to remind them sometimes counties forget that you can get a temporary benefits identification card while it's going on. But the protection is very clear cut. If you represent yourself as being below the Medi-Cal cutoff and you are eligible for Magi Medi-Cal, they must give you Medi-Cal while the application is pending. For non-Magi Medi-Cal members, you can request temporary medical necessity Medi-Cal while the application is pending, but you need to show a reason. It's a little bit more complex. Um, I'm seeing couple of questions here. Mike Eckert points out if your SSDI is over $20,000 a year, you can lose Medi-Cal. That is correct. Quite a few of our SSDI applicants have income that slightly exceeds the Medi-Cal limit. You know, it's not uncommon to have an SSDI grant that is 2,100, 2,200, 2,500, right? And if you are a single person, that exceeds the Medi-Cal limit of this year, it's 1,800, right? As Sarah says, that's really where the working disabled program comes in clutch. If you are able to work even a small amount, that SSDI income will be exempted and your income will be considered as only whatever your employment income is, which could be very minimal. You just want to watch out for that because that's not a situation where you might want to get a part-time job. You want to do you want to make sure you don't trigger, or rather, you want to be very careful about the kind of part-time job that you get so it doesn't harm your ongoing SSDI eligibility. Fernando asks, will Medi-Cal pay retroactively? Yes, Medi-Cal is retroactive. As Sarah says, it is 3 months of retroactive eligibility at the moment. Starting in 2027, that's going to be less. We're going to 2 months for Magi applicants and 1 month for non-Magi applicants, I believe. This is one of the changes that came under federal law. I'm scrolling back through to see if there are any further questions. Yeah, no worries. I'm not seeing anything else. Please feel free to keep them coming. And I thought maybe I'd take the moment to describe spousal impoverishment a little bit more because we'd only given a brief overview of that before. So spousal impoverishment Medi-Cal is the other really important protective program for folks whose income is just a little bit over the line. If you are married and you are in need of either nursing home level care, like literally in a nursing home, in a skilled nursing facility or similar, or you need nursing home level home and community-based care, usually in home supportive services. You can enroll in spousal impoverishment Medi-Cal, which would essentially create a split household where you have Medi-Cal for yourself and your spouse has Medi-Cal is evaluated separately, I should say. And the difference between those two households, it can be pretty extreme. You might have, let's say that maybe your spouse is working full time, that's not uncommon and wouldn't be eligible for Medi-Cal in a million years, and considered together, the two of you definitely aren't, but you need IHSS. You are home, you are disabled, you are not able to support yourself on your own. The spousal impoverishment rule exists to bifurcate that income and so that your income is considered on its own and your spouse's income is not considered at all. The other possibility is if your spouse's income is below a certain amount called the minimum monthly maintenance need amount, which is not the maintenance need amount that we discussed above. It's about 3,700, I want to say. It's around there. If your spouse's income is lower than whatever that number is, which is a federally set number, you can actually send some money over from your account over to your spouse's account. So without getting too far into those details, because that can be a little hard to follow, the bottom line here is that even if you, the disabled recipient, are the one with the money coming in, it may still be possible to split your household in an advantageous way such that you can continue to receive Medi-Cal with no share of cost, and most importantly, so that your IHSS does not drain your whole household coffers every single month. Counties very frequently miss this program. This is so common that counties miss this program. It's because about a decade ago, it used to be just nursing homes, and after a settlement, it was expanded to to IHSS and other home and community-based options. And so counties, you still see people saying, "Oh no, that's only if you're in a nursing home." That's not correct. You may be eligible in an IHSS context. Um, Thank you. Sarah has put a great fact on spousal impoverishment into the chat. I do really recommend reviewing it. It's very detailed. We have some information about immigration eligibility that we're getting into tomorrow. I see that we have a question from Michelle in the chat. For non-documented individuals, are we going back to the PRU call option? And Sarah has linked a really good resource there. Again, because we still have a little bit of time, um, maybe I'll just briefly touch on that. So there have been some big changes to immigration eligibility for Medi-Cal, as we all know. And that's both on the state and federal level. And we'll go into more detail tomorrow, but briefly, as of right now, Medi-Cal eligibility does not consider immigration eligibility at all. Starting in 2026, immigration eligibility will be considered once again for new applicants. What that means is that if you currently have Medi-Cal, you can stay on Medi-Cal. In the new year, you will need to have a qualified status in order to apply. And what's more, the federal government is restricting what qualifies as a satisfactory immigration status later in the year from there. So the number of people who can apply and receive Medi-Cal is going to narrow down over the course of the year. Even people who are maintaining their free Medi-Cal over the course of the year will lose their dental benefits. Many of those people will lose their dental benefits in July. And in 2027, the plan is for a minimal premium to be charged to a subsection of that community. So it's not good news in terms of healthcare access. We'll talk in more detail tomorrow, but the PRU-call option is actually, even the PRU-call option has been somewhat restricted. But the bottom line is that immigration access is access to non-citizen access to Medi-Cal, let's say, has been restricted pretty severely. And it's a little bit harsher than it was before the recent expansions, I'm afraid. Does anyone have any further questions? I know we went through a lot of stuff really quickly. Or Sarah, did you have anything you wanted to expand on?
No, I think thanks for going back over the spousal impoverishment. That can be a gnarly one, but definitely recommend that Canner FAQ. I think it goes through a lot of very helpful explanations and different nuances of things that come up.
Absolutely. Has anyone been having any trouble? I mean, we can't resolve individual issues, we can't advise on particular client problems, but has anyone had any eligibility issues, speaking generally, that they're seeing as a pattern that they want to raise? Ellen suggests a helpful thing would be a reference sheet on things that often get missed that create eligibility, particularly for folks who work with poor men need folks but aren't expert in this. Ellen, I was just thinking about this because there are so many little tiny sub programs that, even besides the ones we've discussed, which are sort of the heavy hitters, that fluctuate year on year. And I might just name a couple of those. The Medi-Cal Access program for pregnant people. If you are having a kid, Medi-Cal is available up to a much higher level of income. Um, the breast and cervical cancer treatment program, which provides Medi-Cal, in some cases full scope, in some cases only to target that treatment for people who are either undergoing or survivors of breast and cervical cancer. The Genetically Handicapped Persons Program provides Medi-Cal to people who have certain kinds of very specific genetic disabilities. Institutional Deeming Medi-Cal, which provides Medi-Cal to people who are clients of the Regional Center under the age of 19. Um, there is a program that provides a discount on your income if you are enrolled in very specific kinds of housing. And then the cost of that housing gets, it's the assisted living waiver, but getting into that is incredibly finicky and back and forth and complicated. So you can like offset that off the cost of your Medi-Cal. There's Medi-Cal through if you were on SSI, even if your income increases, you can stay on Medi-Cal. If you see where I'm going with this, these are great things to keep in mind. I don't know any advocate who is always able of keeping them all in mind. Like I don't know anyone who knows all of this. There was always some additional twist and turn to this program that we're always learning about, because it is just so dense and it is so complex and it is so bizarre. Um, I would say that the best resource that I'm aware of, which does exist and is real, is Western Center on Law and Properties Medi-Cal Getting and Keeping Medi-Cal Guide. It's from 2016, so it isn't up to date, but it still is a great overview of a lot of those programs, and it's that those smaller avenues to access to Medi-Cal are often, we just don't have time to handle them in a training like this. There's just too many of them. They're just too overwhelming. Um, but they are, it is a good idea to ask yourself, I would say in particular, like if I were to teach advocates to learn just a few things about like what do I screen for Medi-Cal eligibility after like what is their income, I would say, are they eligible for the working disabled program, right? Do they have disability based income and are they able to do any work? Are they eligible for spousal impoverishment? Do they need in-home supportive services and are they married? Or are they in a nursing home and are they married? And do they have a particular, like, clearly diagnosed physical illness? Because that's where a lot of those, like, specialty programs come in. Do they have breast cancer? Do they have Huntington's? Do they have et cetera, Lou Gehrig's? That's when you start seeing these specialty programs show up. And
And
if I were
I
screening,
linked, I was just gonna say, I linked the like income chart, which has all the different income levels, and I often use that and scan that because it has like some random different ones linked on top, like breast cancer, parent caretaker, relative, all these other little groups that sometimes get forgotten. So sometimes that if I'm just checking someone's eligibility, I use that as a good reminder of like, oh, is there anything that I might be missing in this case? So that's one
right?
potential resource.
Um, at 100%. We are available. Like, if you're hitting your head against a wall and you're like, is there anything I missed? Call us. Call us with your client, 855-693-7285, or have your client call us directly, Monday through Thursday, 9 to 1. Um, if y- you know, if you would like assistance with a case, that's the best way to speak to somebody, by far. And we can hopefully help you navigate this like incredibly, incredibly complex landscape. I think we should give you 20 minutes back. And we'll look forward to talking to you tomorrow.